Hey guys, Dr. Lee here from Head to Toe. Just want to go over a quick exercise series to get rid of your low back pain. A lot of people getting back into work, you're starting to sit longer throughout the day, whether that could be work or school. So a lot of people creeping into the office with some lower back pain that's pretty pesky. So we're going to go through a really baseline, foundational exercise series, nice little circuit to get you going. So right here we got Dr. Tim, and Dr. Tim is really has seen a couple patients with low back pain like this as well. So this has been a really popular exercise series we've been going through. So the main thing that we want to do to reduce our lower back pain is make sure that we have a nice hardened core here. So if you look at Dr. Tim, he's doing a really good job of providing an example of what rib flare looks like right now. So our flares, the rib flare is the separation of our ribs here with our core kind of falling down. It used to be really popular for us to pull the belly button in, but if we do that without hardening our upper abdominals, which we can do right now, Dr. Tim hardened this in, we're not going to get a very compact, protected core here. So this right here, by bringing these ribs in and contracting our upper abdominals, we're actually introducing some stress to our transverse abdominis muscle, which looks like a big weight belt that surrounds our entire core here. It wraps around the back and the front of the body. If you've ever seen anybody in the gym with a weight belt on, it looks exactly like that. So our first exercise we're going to go through with Tim here is just to find our extreme range of motion with protraction, which is pushing the belly button out, and then retraction, which is pulling the belly button in as far as you can to the spine. So what I want to do here is I want to give him a little bit of a weight. This is a 5-pound weight here. It's a soft medicine ball. At home you can use a kettlebell, you can use a dumbbell, pretty much anything that weighs 5 pounds. I know some people have used even a bag of flour. Definitely not a bag of sugar because we shouldn't have that much sugar at home. But go ahead and grab this on each side here, Dr. Tim. And what we're going to do is we're going to go through those extremes again. So we're going to pull our belly button all the way towards our spine. That's a retraction of the belly button. And then we're going to protract the belly button, which is pushing outward. So again, it's not necessarily that we're going to do these movements throughout the day. And you're just going to go cycle through that back and forth here, Tim. It's more so that we need to find what neutral is. And if we don't know what our extreme ranges of motion are, we're never going to be able to find the center. So it's a really good exercise just to engage those abdominals, get them working. It's a different stress than most people have ever done around their daily life. So most people were going to prescribe this for about 5 to 10 minutes a day. I wouldn't do it for more than 5 minutes at a time though. So if you do decide to do for that 10 or 15 minute range, break it up throughout the day, like a breakfast, lunch, and dinner type of thing. Don't think that you have to do it all at once. I don't want you to do that because then you're going to be real tired. So first exercise of the day, call this ball breathing. Next one we're going to go through is just going to be based off that. So now we're going to bring our abdominals, we're going to get it into that neutral positioning. So we're going to harden our core at the upper abdominals here. That rib flare goes away. We're going to tuck our pelvis into posterior tilt. So we're going to rotate backwards into this direction, flattening our lower back against the ground. And then we're going to take our hands, put them over our chest. We're going to raise our arms over our head, going all the way until our thumbs touch the floor. So this is a perfect speed right here. It's going to take us about 10 seconds to do 1 rep. And what we want to do here is keep this core hardened. We want to keep that posterior tuck on our pelvis, keeping our back nice and flat, flush against the ground. So with anybody that's going to be coming into the office here, we're going to have them do this exercise 3 times, 10 reps each set. So some people can't do 3 sets of 10 right off the bat. That's okay. I'd rather you break that down to 5 sets of 6. We want to shoot for around 30 to 50 reps whenever we do this exercise. And since Dr. Tim is lucky enough to do this exercise pretty much every day to show people he's really good at this, he can do that 5 to 10. He's prepared for it. If you were to go right into doing 5 sets of 10, you'd probably be extremely sore the next day, and that would mitigate the actual benefit of the exercise. So don't do too much. Take it step by step. With that, we're going to move on to our next exercise. Another basic exercise is going to be a dead bug. And this is actually going to be a regression of the dead bug because we don't actually want full extension, full activation just yet. If we're just starting to get our back pain, we're just starting to address it, we're going to regress to a pretty easy exercise. So with the dead bug, we're going to have both of our arms out in front of us. We're going to raise them off the ground, and we're also going to raise these knees and pull them into a 90-degree bend. So if you look at him, he's in a squatting position. If you think about it, if we were to flip him 90 degrees, he'd be sitting in a squat. So the dead bug exercise, we're going to extend the opposite shoulder and opposite leg. So say we're going to move this left leg and this right shoulder. What I want Tim to do is straighten out this arm and drop his heel to the floor. And then we're going to bring right back to center. So So that was perfect pace. We're going to replicate that on both sides. So we're going to do this left arm, right leg, and bring it right back. For anybody that's starting these exercises, we don't want to do too much because we don't know if this is going to irritate them. So I usually have people start with 3 reps a side, and then we go up to 5 reps a side, and then if they handle that without any issues, we can go to 8 or 10 reps a side. If, say, Tim had a hot low back right now, I wouldn't want him to go more than 3 sets of 3 on each side. And that's what we'd start with, working up to that 3 sets of 10. Nice. I'm gonna take a break there, Tim. How'd that feel?
Feel good?
Cool.
Yeah.
So that's going to be a nice, easy circuit to help us reduce our lower back pain. Like, say, it's starting to come on. Like I said, people that sit for long periods of time, people that even stand for long periods of time can develop these nice, tight low backs that can turn into pain, especially if it's referring down the legs. That's going to be a really good time for you to call into the clinic, get an appointment sorted, and have us take a look. Until next time, guys. Thanks.